If I gave you like a magic wand, right? What do you think needs to happen in order to turn the tides around in terms of what the nation, is facing? And over time, it doesn't seem like it's slowing down anytime soon. Like, what do you think needs to happen that turns the needle and impacts it the most from your lens? Is it like legislation? Is it, what I'm saying? Like, what needs to happen from your point of view?
You mean it's not Ozempic?
It seems like it's Ozempic, right?
So, well, if we had a really magic wand, we'd go straight to the end, But if we had kind of just a surrogate marker in the middle magic wand, it's the most exciting things happening in terms of some of the policy stuff are this kind of choice architecture, these default plant-based options. So like what we saw, I was just in New York City, where Mayor Adams has instituted every single one of the 11 public health hospitals by default, whole food plant-based lunches and dinners. And most patients are sticking with the defaults. That's changing millions of meals every year. And think about that role modeling power. I mean, healthy food in a hospital, like what a concept. And so, and it's really just about making the healthy option, the easy option, the healthy option, the default option. We're not taking away anyone's chances. It's your body, your choice. You want to do whatever you want, but you're going to have to go smoke outside, basically. I mean, it's just these little things. And so, I think that can be exploited in terms of kind of institutional change. It's like, why aren't we feeding our school children healthier food, right? Why aren't we feeding our government workers healthier food, our military healthier food, our prisoners healthier food? And these are all kind of public capacities. We don't need to wrestle some corporation to the ground and get their shareholders to all of a sudden value health over money. It's like, well, no, we have a say in the public process. And it's like, we could be, sending federal dollars one way or another in terms of what we're researching, what they're putting into practice. And that could kind of role model for the rest of society. So much of, the recidivism we see in people that start eating healthier, then go back to eating the standard American diet. It's not that they didn't feel good, didn't like the food. Like the number one reason are these social pressures. Food is so interwoven with our social relationships, our family, our work. It's just kind of hard to be kind of the odd person out. That's what kind of drags people back into the mud. But the more society changes, the easier it is to eat healthy, the more it just becomes mainstream. Then it'll have this really cumulative snowball effect where all those in the middle who, look, no one wants to be unhealthy. Most people have a general understanding of what's healthy eating. They just find it difficult. But once it's easy, once it's accessible, it's affordable, once everybody else is doing it, get that kind of vast middle to change. And of course, there'll still be the people right now. I think we still have 14% of people smoking in this country. But, it went from essentially almost nobody at the beginning of the last century